COVID is not top of mind for a lot of us these days. Isn't that wonderful? The people whose job it is to be vigilant are watching the UK, where the COVID trends tend to start 2 weeks before they emerge in the U.S. Anusha Roy tells us what they're seeing.
EDPHE is watching Germany, Italy, Netherlands, and the UK to help model what could happen here.
The UK is probably most similar to us in terms of the spectrum of vaccination rate.
UK reached record levels of infections with the help of the BA.2 variant, the subvariant of Omicron.
In those that have some level of immunity or protection through vaccination, we seem to see a lot milder course with this.
Hospitalizations and deaths are going up, but at lower rates than earlier this year.
So far, we've dodged the bullet.
Jonathan Samet is the dean of Colorado School of Public Health that models COVID. And even though the same variant now makes up around half of the cases in Colorado, with that number expected to go up, we are not following the UK's trajectory right now.
Would we have seen a change in cases at this point?
About the point where we would expect to start seeing that, turn upward if it's going to happen.
So what's the difference? It's more than vaccines, but natural immunity too.
We did experience an awful lot of people who became infected with Omicron, and perhaps more than took place in some other countries.
We're in this nice little zone right now. Now, could that change? Yes.
And Dr. Michelle Barron said timing could be a big factor if variant cases continue to go up over the next several months.
Immunity potentially waning for those that maybe had Omicron in January or February. If our vaccination booster rate and just vaccination rate stays still, then you have a bigger proportion of people now that are going to be vulnerable to this.
The hope, though, is more people would recover at home and our hospital systems would be okay.
While perhaps not as protected against infection as we would like to be, we certainly have a high rate of protection against severe disease.
Also, with a lot of people testing at home now, we may not really actually have the full picture of how many people have COVID right now. The models, however, preliminary in Colorado show that if we did see an uptick, that could be happening in the next couple of weeks. But really, Kyle, it would be a muted uptick versus what we've seen in the past, especially for the people who are falling the most sick. But, the experts are saying they're just going to kind of watch the next couple of weeks and see what happens here.
I honestly love not having to worry about this every day.
Awesome.
And the only thing that I really want to know is, when does the advice change?
Right. And at this point, they're saying the advice is kind of the same as what we've been hearing over the last couple of weeks, right? Just assess your personal risk, see what's the best for you of how you want to live with COVID, and then just go forth.
Yes.
It's amazing. I love saying that.
Thank you, Nusha.